Okay. Okay. We look like we're live. We're live. Hello and welcome to the Global Youth Mental Health Awareness Show, where we have an open conversation with young people, the youth about mental health. I'm your host, KATINDA, author of The Big Comeback and the founder of the Confidence and Self-Esteem Academy and one of GYMHA's Specials Board advisors. In today's show, we are blessed to have two amazing panelists. I can see we have one on the show right now, so I'm just going to welcome her. And as we go along, if the other panelists connect with us, I'll be able to introduce her as well as we go along. So today we have Emanuela Maina. Emanuela is GYMHA's Project Support Officer, undergraduate research assistant at the O'Neill Institute for National and Global Health Law. Hello and welcome to the show, Emanuela.
Hi, KATINDA, and thank you so much. That was a lovely introduction.
Yes, it's nice to see
Yes.
you. So, in our conversation today, you as a guest, and we're
Yeah.
going to be having Ubani joining us. You'll be
Mhm.
giving us some insights on unemployment and depression right now because we have COVID-19, which is affecting a lot of people. But before we
Yes.
do that, I'd love
Yes.
to ask you, how are
Yes.
you feeling today?
I am feeling good. I'm excited to be here, and it's a sunny day here in Nairobi, Kenya. So it's basically a beautiful day.
It's a nice day. Okay.
Yes.
Well, I'm in Melbourne, Australia, and it's nighttime and it's
Uh-huh.
winter. It's winter
Ooh,
over here and it's about maybe 11 degrees, I think.
wow.
So, yeah,
It's
so it's a
cold.
little bit cold, a little
Mm-hmm.
bit. Yeah. So, we know there is a major shift in everyone's life at the moment, right? And
Yes.
COVID-19 was introduced to us this,
Yeah.
2020. And
Mm-hmm.
we know life will never be the same again.
Yes.
So we have seen so many people lose their jobs because of, I guess, COVID-19. There's no way they can go to work. So
Yeah.
how is COVID-19 pandemic affecting our mental health? What do you have to say about that?
Well, I believe that the pandemic is affecting our mental health either positively or negatively, depending on how you look at it and how much it has affected you. I know so many people who've lost their jobs, and especially the youth. For example, I have relatives and friends who are in the tourism sector, and we know the tourism sector took a very big hit because of the curfews and the lockdowns worldwide. So some of them were sent home. And I know so many young people who started doing drugs as a way to cope with the depression. So you see, when somebody talks about depression, COVID, you're like, how are the two related? But if you look at what happens, how people maybe lost their jobs, or the young people who are trying to penetrate the employment market and they're unable to because companies are downsizing and restructuring. So many people feel hopeless, and they may try to cope, but in ways that are negative, and depression takes a toll on them. Yeah.
Sure, thank you for that. I see we've got Ubani joining us, so I'll just introduce her. So hello and welcome, Ubani, to the Global Youth Mental Health Show.
Hi, good
How you
morning.
doing? Now, I'll just introduce you. So Ubani is a passionate educator, mentor, social entrepreneur, advocate of the United Nations SDGs, and executive director, Education Sustainability Volunteers Organization. Welcome and hello again.
Thank
So,
you so much for
so
having me.
before we continue, I always like to ask, how are you feeling today, Ubani?
Oh, well, the weather is great. I'm all right. So I'm grateful.
I think we can hear you very well. Do you want just to
Can you hear me right now?
a little bit better? Yeah.
Okay. I said the weather is great. I'm all right. So from where I'm coming from, everything seems to be great. So I'm thankful.
Thank you. Thank you. So we were just talking about how the COVID-19 pandemic is affecting mental health. What is your take on that? How do you believe it's affecting a lot of people's mental health?
Well, it actually does. And, you know, sharing my own experience from the period where the pandemic set in 2020, it was really tough. And if you live alone, you know that at some point you feel like the whole world actually shut down on you. And your family members are not there to walk you through, to talk to you, to tell you at some point that everything is going to be all right. So during that period, I was gripped with so much fear because I was 5 hours away from my family, and it was really tough. I was thinking about how my parents are faring, how my siblings are faring, if they've gotten the virus, and the whole thing actually messed up um, with everything around me. So it was really tough. COVID-19 actually did put so much challenge when it comes to our mental health. So what actually helped me heal was contacting friends, calling them all the time, and always being in touch with a health professional to ensure that I'm actually keeping the right precautionary measures and staying healthy and staying fit. So COVID-19 did actually affected our mental health, and I could testify that it touched me, got me at some point, but with the help of friends and family, I scaled through.
Thank you. Thank you. And Emanuela, so what
Yes.
can we do to cope with the effects of COVID-19 quarantine and lockdowns?
Well, I think one of the things we need to do, we need to, first of all, take it slow. You need to tell yourself that you're not the only one in that situation. This is something that is affecting everyone. Everyone is shocked. Everyone has been shaken. So, first of all, we need to encourage ourselves that way. And we need to, as Ubani has said, she talked to her family members on phone. Yeah, we need to, look um, we need to talk to our friends and our family members whenever we feel, we are slipping into depression. And we also need to check up on them, even if we feel we are fine. We don't know how they may be doing. And I also believe one of the ways to cope with COVID is to, start learning new skills because, as you said, the world is different. We are not living in the same world we were living in 2019, 2018. So now everything has moved online. You see, for example, with this live show, maybe if it was before COVID, we'd have to travel, meet in a room somewhere and have a talk. But now things are slightly easier. It's not all bad. You see, you're in Melbourne. Ubani is in, I'm not sure, but I think Nigeria. I'm here in Nairobi. And 5 minutes, we connect, we talk, and it's not all bad. That's what I'd say. Yeah.
Great. Ubani, what are your thoughts on that? What can we do to cope with the effects of COVID-19 quarantine and lockdowns?
Okay, I'll have to talk about what actually worked for me, and I hope it worked for another person. Um, I engage so much in reading, not necessarily about books, non-fiction, but generally things that I find pleasure in reading. It could be magazines, it could be non-fiction, but it could be story, it could be some research. And I find joy in talking to people and enlightening people about a particular phenomenon. Okay, so exercising a lot gives me great joy. So keeping fit, eating healthy, and doing those things which I enjoy doing, from baking to cooking and to spending time on the phone, on virtual meetings with friends, with families, actually help me a lot. And most importantly, when we are bothered about something or we are going through stress, I encourage everyone not to keep silent. There is this there is an I think it's common when it comes to Africans. When you're being asked, how are you faring, how are you doing, everyone says I'm okay, even when they are not okay. They say they are fine, even when they are not fine. We shouldn't keep struggles, we shouldn't keep stress and challenges to ourselves. It doesn't make it go away. When you talk to people about what you're going through, you get help. I remember when during the lockdown, I underwent a procedure because I needed to speak with a health professional, and I was doing so much at that time. I was attending to virtual meeting. I had so many programs going on. I wasn't all right. I wasn't good. I wasn't feeling at my best. And when I'm being asked, I tell people I don't feel good. I'm not fine. Then we need to sit down and talk about it. We need to sit down and talk through it. If the solutions are just by the next door, or if there is an advice that could help you heal, it does magic. So when we are in troubles or when we are going through stress, it is important to talk to someone who you can confide in. It could be a family, it could be a friend, it could be a health professional. All right. I had a great friend who stood by me. At a point, I felt like I was alone. I always show up stronger. I'm always giving out my shoulders for people to put their head on. I'm always there to listen to people's struggles. But how can people understand my own struggle when I don't talk about it? Some see you as a strong woman, you're phenomenal, you're doing amazing things, but deep down you are going through stress. You are not at your best. So the right thing to do, find that which you're passionate about. Talk to people. If there is a need to seek for a health advice when it comes to your mental health, there are calls, there are organizations that are out there who you can easily reach on the internet so they could help you. So with this way, I believe you're going to live a very happy life, a fulfilled life, while doing the best you can do in serving humanity. Thank you very much.
Thank you. That was amazing. That was very informative because, again, really, I know most people who are doing a lot of things out in the planet, people think they're really strong and they've got everything together. And a lot of times, not really. We just hold ourselves together, but it's not the case. It's always good to ask, how you doing? Are you okay? And it's okay not to be okay too, because I think we're so paranoid of people thinking, oh my gosh, she said she's not okay. Yeah, but it's life. It's okay to not be okay. And it's a question of also finding people that you can trust, that you can actually confide in, because that's where I think the biggest issue is. Who do you talk to if you're not speaking to a professional? If you don't have family members who are close, if you don't have close friends, then where do you go? So I think, again, reminding people you're not alone. There's so many people on the planet that you can reach out. You can reach out on people online. I mean, there's a lot of people online advocating for what we're doing today. They can reach us to us too, because that's why we're here, so that they can reach to us. We don't have to be your friend. We don't have to be somebody you know, but we are here for that reason. So you can reach out and we can support you. So moving forward, how does one deal with depression after being declared redundant owing to the effects of the pandemic? Emanuela, what do you think?
Well, for me, I think my opinions are from, what I've heard from others, because sadly, I'm still young. I haven't, been in the industry for long yet. I'm just starting out. But what I know is there's this lady, she is one of my mentors, and she was working for a big organization. And then, during the pandemic, they were told, we no longer need your services anymore. And that comes as a shock, because maybe you thought you think of security, you thought you had security in your job, and now all of a sudden you no longer have that anymore. You have to start from scratch. So what I know this lady did, at least she had her savings, so that helped her a bit. She had her savings, and now what she did, she invested in, learning courses online. She revamped her LinkedIn profile, and, she reached out to people. Having connections is also good, people you can talk to, and people who might have businesses and may be able to employ you. She reached out to such people and she was able to get something small to do. And I know of people who've also started businesses online, like young people here in Kenya, for example, sell clothes online, like on Instagram. People who bake maybe open pages and advertise their products. So it's always good to use your extra skills so that even if you're declared redundant, you have something you can do. And one of the things I learned was that it's good to have savings to prepare for a rainy day, because right now we are not exactly sure about what is going to happen tomorrow and the day after that. So you need to prepare yourself. You need to look for extra skills so that you're able to navigate this tough period. Thank you.
Thank you. What about Ubani? What would you want to say? How does one deal with depression after being declared redundant owing to the effects of the pandemic?
Well, I would say that getting help should be the first thing to do. Speaking up. You know, when you speak up, you get help. And sometimes people who are depressed don't even know that they are. They feel that they are okay, that everything is going really well with them. You know, there are different stages of such experiences. First of all, you begin to feel like you're losing your self-confidence, you're not worth it, right? And then the next stage is you want to feel alone. You just want to shut out of every other person in the world. You enjoy your privacy. You just don't want to talk to people.
True.
And then another stage that happens is the mood swing. This minute you're all excited to the peak, and the next minute you just shut out, right? So all these signs shows that someone is going through so much. And if you're a loved one who have noticed this kind of signs, do not keep quiet. Bring such person closer to find out what that problem is. Because depression, it's not magical. It's a process. It undergoes different stages. And if we care so much as human beings, we should be able to spot that and get help for that person immediately before the person gets into trouble. People who committed suicide must have shown those signs and they were neglected. These signs should trigger people who are close to them or concerned guardians that something is wrong somewhere. You know, we are in a part of the world where we don't seem to take things seriously. I'm an educator, and at some point, when I was working in school, I met with a parent. I told the parents, please, you need to go and do some checks on your child. I feel that your child has ADHD. He's very hyperactive. And then the parent led up, no, you are not a medical professional. You do not have right to tell me this. You don't know this. You don't know that. I'm not a medical professional. I'm an educator, and I've seen those signs. And this is why I'm calling your attention as a parent, because you need to act on it. And it took them about a year or more to realize that, when the child probably had gone on a vacation. And the same advice was given to that parent to run such tests. You know, when a medical professional speaks to you, they are concerned about your well-being and that of your child, as well as educators. So we shouldn't take things lightly. The earlier we begin to tackle a problem before it becomes an emergency, the better for us. Okay? So when we begin to see these signs, attention should be given to that individual. And when that individual gets help, there will be no reason for that individual to move to a critical stage or a stage that is going to be an emergency stage. So my advice is that this is a really difficult moment for all of us. And we could have a family member who has been affected by the virus, and all we need at this time is to support them. Some have gone through losses, Some have buried someone, some are grieving, some are going through terrible situations. And this is not the time to close our ears or to shut out on them, because none of this was planned. None of this was, we were not prepared for this. We didn't know that in 2020, COVID-19 was going to strike. So we all need one another. We all need to work together. Humanity first, regardless of class, race, background, roots, ethnicity, culture. Life gives no regards to that. And when we uplift someone else, the same person reaches out a hand to uplift another. That makes our world beautiful, and humanity will continue to thrive.
Thank
So
you.
in all, we just need to be there for one another during before the depression gets to an emergency. Thank you.
Thank you, Bunny. That was very informative. You went into detail about how we can actually be human, because I think sometimes we forget to be human and it's all about us. It's not about your brother, your sister, your fellow workmate, and everybody you meet. So if you've just joined us, we're talking about unemployment and depression amidst COVID-19 pandemic. Please click share, comment, and invite your friends to watch and ask questions, because that's why we do this show. So we can support you, we can inspire you, we can give you some insights on mental health, and anything that you might like to ask, please feel free to inbox us and we'll find somebody will respond to you as well. Now, moving forward, how can we access psychologists and counselors when in quarantine? Emanuela, what would you like to say for that?
Well, I'd say we would be able to access psychologists and psychiatrists and counselors online. I've seen so many, for example, in the West, I've seen some apps where you write your name, write what is affecting you, your religion, if you're religious, and they're able to connect you to a therapist who will be able to give you advice based on what you feel, is affecting you. And of course, that doesn't, okay, of course, it's not 100% because, sometimes you need a diagnosis from a therapist. You need to see a therapist in person so that they're able to tell you, okay, I think and feel this is what your issue is. But what I know is we have institutions that actually connect people to therapists. For example, we have Befriended Kenya. Befriended Kenya is an organization where, for example, if you're feeling depressed and you call them, they'll be able to connect you to a counselor. And if you're in quarantine, of course, you will have phone call sessions or virtual sessions, the way we are having a virtual session now. So I think that is one of the ways we can cope with depression during quarantine. But I know for people, for example, who are in the villages and they may not have access to internet, it might be a bit of an issue. But I've seen some organizations that send people there, of course, adhering to the COVID-19 rules and guidelines, masking up and, sanitizing. So maybe they may send 1 or 2 counselors to the villages and, hold a session with a few people and, educate them, encourage them. And yes, I think everyone is trying to do what they can to make sure they survive and that they are okay mentally. So I think that is one of the ways we can do it. You can do it online through virtual sessions, calls. You can also reach out to your friends and relatives in the event that you cannot access a therapist, and maybe they can connect you to someone who can help you, or organizations such as GYMHA. We have people who are trained on mental health and first aid and, can encourage you when you need some uplifting. Thank you.
Thank you. Thank you. And Ubani, did you have anything to add to that? Ubani?
Yes,
Okay.
please. Can you hear me?
Yes, I can now.
Oh, thank you. Yes, definitely. Getting an online help is very, very important, because As much as we are observing social distancing and some are still at home. In other parts of the world, they are still on lockdown. But here in Nigeria, we happen to observe some safety and health precautionary measures. So having a psychologist to have a one-on-one conversation is very important, because not everything is expressed online that much. Some are not good when it comes to typing, some are not good when it comes to phone conversations. But when they have an individual, a personal relationship or a conversation with you, you get to understand them better. So as much as we are trying to go online to get help, psychological help, or an advice or counseling when we are going through some certain phase in our life, we should also book a session with a trusted psychologist. So in Nigeria, we have the psychng.com, where you can speak to a counselor. They're very good when it comes to helping people who are depressed or going through anxiety, PTSD, and all of that. And it also has 360 sites. So these two service organizations, will help you to feel free to talk to them. They'll provide you with the need or the help that you might require. So it's very important. Go online and also book a session offline if need be. Thank you.
Thank you. Thank you very much. And also, I believe, people need to not start worrying about stigma, because this thing with mental health, we've had stigma for so long that people don't reach out because of what other people think. And when you're reaching out to people who are professionals, or even people who are not professionals, I think even like family, I think people now realize that they need to really keep this confidential, because it's not something you go advertising, so-and-so's got this problem and they call me up to ask for help. So it's about people realizing they need to maintain that confidentiality just to help people to trust them. Because if you can't trust one person, then if one person goes saying something, anybody who hears that will never seek help, because they'll think, oh, that will happen to me too. So I think we need to step up in the game of the gossip side of things, the negative side of things, and just be able to support one another, especially now is the time. It's not a time to be judgmental. It's not a time to be talking. It's about saying, well, we need to help each other. We need to get through this together, because that's just what we need to do. Yeah. So how can we support friends and family members who might be experiencing depression during the pandemic? Ubani and also Emanuela, you've talked about, of course, talking to each other. Is there any other way you think we could support friends and family?
Yes, I believe there are other ways we could support friends and family. Of course, first of all would be to talk to them, see what the issue is. Then once you realize that it might be beyond you, and this needs, the expertise of a mental health professional, maybe we can take it up to ourselves, because sometimes when your friends and family are reaching out to you, sometimes they are so low, they are not able to reach out to the therapists and the counselors themselves, or maybe sometimes psychiatrists. If it's something that needs psychiatric care, then maybe you as the family member or the friend can go the extra mile and reach out to these professionals, maybe book them an appointment. If you can't drive them there, or even if you're using public means, accompany them and, be there for them as they get help. And sometimes, for example, in instances where it's something extreme, maybe they are extremely depressed and are suicidal, they might need emergency health care. And that is a moment where you need to contact a psychiatrist or maybe a psychiatric institution, and they will let you know on the way forward. Maybe they'll get a diagnosis, and if they decide the person needs to be admitted so that they can get care, that can happen. So I believe as friends and family, the main way we can help our friends who are depressed is by getting them the help they need, because sometimes maybe they might be in denial, or maybe they are too low to actually reach out to the right people for that.
Thank you. Thank you. What about Ubani? What would you like to say?
Yes, family members play a very huge role in ensuring that we get the right help. Just like Emanuela mentioned, all right. Some actually come from a toxic background, I would say, because there's not much of that relationship between parents, children. There is no relationship basically. And that actually puts children or individual coming from such family in a very tight situation. So when you're coming from such family where you can't trust anybody, you can't even disclose some certain things to your mother or to your father or to your siblings, you keep hurting, you'll be dying in silence. So when a family comes together to proffer solutions to problems, it brings about relief. And when a family member is in a dying situation, having the family around who revive that person to help, it's very therapeutic for me. Okay, when someone is going through so much and knowing well that there is a family who is there, who cares so much, who always stand by them regardless of the situation, it improves and encourages healing. For me, there are some situations I will find myself in. I might not be able to discuss that with my father. I'll talk to my mom, and she is going to be the only one who's going to know about that. So, daughters, we have this kind of relationship with our mothers. I don't know for others. Some are daddy's girl, and some are mommy's girls. So for me, I feel that connection more with my mom. So when she advises me or tells me on things to do, why she backs it up with prayer, because we are very religious people, and we shouldn't leave everything to the religion aspect of that. We need to do the work. We need to take action. When you're unhealthy, you don't go to church praying about it. You go to the medical professional and seek solutions. While the medical professional is working hard to ensure that you get back to health, God is using them as a tool to get you healing. But when you're going overly spiritual and you already know the right thing to do, first of all, take action, because faith, as the scripture says, I'm a Christian, faith without good work is dead. So while you're hoping and you're believing that you get back to health and you're working, you're putting in your best to ensure that you get, then God answers you, right? So family is a very, very unique and important unit in our society. So whatever the society becomes at this time begins from home. If we have a very bad society, people who may actually make up the society is every one of us here and every other person across the globe. We are a part of the society, and we are coming from a background. We are coming from a family, and as our family is not doing the right thing, if our family isn't raising us to be contributing, to be useful people in the society, then we are also getting the society into a really bad state. So we need our families support, we need our close friends support, we need the support of medical professionals to heal and to reduce the rate of depression among youth. Thank you.
Thank you. Thank you. So if you just joined us here at the Global Youth Mental Health Awareness Show, we are talking about unemployment and depression during COVID-19 pandemic. So please feel free to share, to comment, invite your friends to watch, ask questions, because that's why we do this show, to encourage, inspire, motivate, and give you a platform where you can actually ask questions, seek help if you want any help. And remember, you're not alone. Yeah. So before we conclude, I like to just ask, how do you protect and manage your mental health and well-being? So, Emanuela, what is one thing you do for yourself on a daily basis to check in with your mental health and to soothe your soul?
Well, actually, I have been depressed before. I actually ended up being admitted because of that. And it was actually last year during when COVID had just started. And the effect, I personally, I am an extrovert. So when we were told, okay, now you have to stay indoors because of this virus that is spreading, and it is, you can get infected. So you need to stay indoors. It really affected me. So after I was admitted for like 3-4 days, and I had a psychologist who came to see me and we had a conversation. So she asked me, Emanuela, what are the things you enjoy doing by yourself, that don't involve you being outdoors or you being with friends? So one of the things I enjoy doing is writing. So she told me, yes, get a journal, make sure you write. Jot down your thoughts. What are you feeling today? Am I happy? Am I sad? Am I angry? Am I frustrated? And that has actually really, really helped me. I keep a journal. I write down my thoughts. Sometimes, I just relax, take a nice long bath when I can. And I also talk to friends and tune into podcasts, and especially podcasts that talk about mental health and things like that. So that is one of the ways I keep myself sane.
Oh, thank you for sharing that, because it's always good to know that there's actually real people there who are actually going through what we're talking about. Because sometimes, we come here and talk about it, but then when you are actually a person who's actually gone through it, it helps the audience, relate and sort of connect and realize, oh, that was me last year, or that is me right now, that kind of thing. So thank you so much for sharing. And Ubani, what is one thing you do for yourself on a daily basis to check in with your mental health and soothe your soul?
Sorry, please, could you repeat the question?
Okay, so what is one thing you do for yourself on a daily basis to check in with your mental health and to connect to soothe your soul?
Oh, great. I try as much to get enough sleep. Sleep helps to calm my nerves. And especially when I'm tense and I know there are some certain things I do not have control over, I sleep over it, basically. Because the more I stay awake, the more I worry, the more it's going to affect my mental health. So I sleep over it. And when I wake up feeling rejuvenated and refreshed, then I could begin to bring out plans, strategic solutions to solving that problem. Sleep is number one for me. And secondly, working out. I enjoy playing badminton. I enjoy playing volleyball games. So everyone in a day, I choose to play one of them, right? So when I play that game, I come back, take my shower, I drink a lot of water, which helps a lot. So when you take a lot of water, you get enough sleep, you do that activity that you love. For me, it's sport. I like staying fit because when I'm fit, I'm smart, I get to achieve more. It also keeps my health in check. Okay, so these are the things I do on a daily basis. Play badminton or volleyball, get some sleep, do drink some water, and then carry on with my activities for the day so I don't get so stressed that I can't handle the situation myself. So that's what I do.
Thank you. Thank you very much for sharing, because, I am a big believer in keeping fit and exercising, moving your body, because if you don't move your body, then obviously you start getting tired, you can't sleep well, you start getting injury. There's a lot of things that go wrong. So as for me, in terms of what do I do to check in with my mental health and soothe my soul, I do a lot of journaling, but a lot of mine is about, I do a lot of gratitude journaling, like what am I grateful for? When I wake up in the morning, the first thing I say, and I always say to everybody, if there's only one prayer that you need to do or say, is thank you, gratitude, because that is just, I'm grateful to be alive, because if you don't have breath, you won't be here to do anything else. So just being grateful of being alive, having breath is just number one for me. And then I meditate, I exercise a little bit here and there, but also I drink warm water with lemon in the morning. That's the first thing I do, just to get everything happening and to cleanse my, my internals and just everything like that. So, and I try to keep very positive. So I try to not watch the news as much, because I don't like to hear all the negative things happening in the planet, because I feel if you start your day with bad news, definitely your day is not going to be a good day, because everything is about people died, something happened, COVID-19, it's always constant. So I always try to make sure I don't have to deal with that in the morning. I'm okay late in the day, but not the first thing in the morning. So that's just me. Yeah, so before we finalize, what's one message, Emanuela, you can leave with the viewers today? What is something you would like them to do, like to start doing right away?
Well, one of the things I'd love the viewers to start doing right away is to think positive. Yes, this is a pandemic. We are living in a pandemic. Things have changed. But I think one of the things we can do is to try and look at it positively. What can I learn from this? What can I do to change my situation? And when I need help, do I look for it? Do I tune into programs such as, GYMHA's live show on Thursdays to get some encouragement? Do I keep the right company? And yes, that's what I'd like to leave with the viewers.
Thank you. Ubani, what's one thing you would like the viewers today to start doing as an inspired action straight away after watching this show today?
Thank you so much. I think one thing I've always done, right? So it's not like I'm starting it all over again. I've always done it to listen to people and don't judge them by the situation or the circumstances surrounding their problems. I've got a lot of DMs on Facebook. People come to talk to me. Please, I need someone to talk to. I'm like, okay, go on, talk to me. What's the challenge? Someone recently got in touch with me about the stress she's going through her study. She's in her final. She feels she's alone. She's getting depressed. And I had to share my stories with her. I told her that she wasn't alone. All right. Giving people that attention and calling your friends, reaching out to them to know how they are feeling is a great way to know who is in trouble and who is out of trouble. Okay, not everyone will always call or get in touch with you. You could just slide into some person's DM. Sometimes I do that. If I don't get to see your notification or your post on your timeline, I go to your DM. I ask you, I haven't seen you, I haven't heard from you. Is everything okay with you? I hope you're not in trouble. If you need someone to talk to, I'm always here. So that gives them a sense of fulfillment. That gives them a sense of love and care that someone out there, a stranger or maybe a friend, is actually there to listen to whatever situation that they find themselves in. So reaching out to people, being empathetic and not judging people will help them to open up to you more. So first, humanity first. That's what I always go by. So when we do that, we make our world a better place. So I'll continue to do my part. I'll continue to be that mentor. I'll continue to be that shoulder and people can always lean on. To talk to, I'm free, I'm open, I'm just there anytime I'm needed.
Thank you.
So
Thank you.
basically, that's what I can do.
Thank you for that. And now, before I continue, just before we're about to finish, I have to remind the viewers today that we have our second annual Stress Management Revolution Summit 2021, which is on the 28th and 29th of August, 2021. It's 7 p.m. Australian Eastern Standard Time. So if you're overseas, check the link on GYMHA's site to see what time that will be in your country or in your zone. Now, it's going to be an online Zoom, obviously meeting, because we're all in lockdown, some of us, and we're all from all parts of the world. And really, I think I need to encourage people who are watching, to let your friends know about this, because this is going to be mind-blowing. It's going to have so many experts on different aspects of mental health. This is mental health in every way you can think about, from relationships to depression, PTSD, just anything, mental health, employment, everything. There'll be so many professionals talking about this issues that are affecting us, and it's free. So there's no charge for that. So please, to get more information, go to the Global Youth Mental Health Awareness or visit our website, www.globalyouthmentalhealthawareness.org, or you can email jude@gymha.org to get more information about the summit if you don't already know about it. But before we go, so where can people find you, Emanuela? Are you on social media? Are you on Facebook? Where are you?
Sadly, I shut down my Facebook account some time back, but you can find me on LinkedIn, just Emanuela W. Minor. And once I open a new Facebook account, I will definitely share. Yeah, but for now, I'm only on LinkedIn. Yes.
That's fine. That's still a contact. That's good. That's no problem at all. What about Ubani? Where can they find you?
I'm everywhere on social media. I'm on Facebook, I'm on Twitter, I'm on LinkedIn, I'm on Instagram, Ubani Vivian. Yeah, basically, Ubani Vivian on LinkedIn, Ubani Vivian on Facebook, Ubani Vivian on Twitter and Instagram. So you can easily reach out to me.
Thank you so much. What you can also do is just type that on the link on the comments once we finish the show, so people can find the details as well. Yeah. So thank you so much for today, Ubani and Emanuela, for sharing your insights on unemployment and depression in the middle of COVID-19 pandemic. I want to thank you, viewers, for being so fabulous and being a fabulous audience, and for watching the Global Youth Mental Health Awareness Show. Now, we don't have a topic for next fortnight, but please stay tuned, check our Facebook page and see what is happening there. And until next time, may you all experience the frequencies of love and light. Stay safe and stay blessed. Bye for now. Okay. Just making sure we're not on Facebook.